Good afternoon, everyone. Thank you for joining today's webinar. My name is Daisha Washington, and I am a program analyst at NATRO. And I'm very excited to be co-hosting this webinar alongside NCSD, which is the National Coalition of STD Directors, to provide you all with the opportunity to learn about Let's Get Checked and the Check Yourself program. Both were designed to allow for health departments to provide patients with access to self-collected STI tests. And so we will be learning a lot about those initiatives today. And so as far as our agenda, after this welcoming part of the session, we will kick off the webinar with NCSD. We are joined today by Jennifer Mon, who serves as the Director of Clinical and Sexual Health at NCSD. And alongside Jennifer is Jessica Zamora, who serves as the Senior Manager for Home Testing at NCSD. After their presentation, we have two health departments that will present on how they have been using the platform. And this includes Dr. Shabita Raj from LA County Department of Public Health, who serves as the Senior Physician at LA County, as well as the STD Clinical Chief and Associate Medical Director. Following Dr. Raj's presentation, we will have Alicia Steins and Sadie Nolan, who both serve as public health nurses at Lynn County Department of Public Health in Iowa. And so again, very excited for this webinar, and thank you so much to our presenters for being available. Following the presentation, we will have a Q&A session, so please enter your questions in the chat. And so now I'm going to pass it along to NCSD.
Thank you so much, Daisha, for that introduction, and thank you to all of you for being here. My name is Jenny Mon. I'm the Director of Clinical and Sexual Health at the National Coalition of STD Directors, and I'm joined by my esteemed colleague, Jessica Zamora, Senior Manager, Home Testing. So we'll kind of tag team this presentation. Next slide, please. So before we begin, I just wanted to clarify some names. So the National Coalition of STD Directors, or NCSD, is a national public health membership organization that supports STD programs across the country. It also supports DIS, sexual health clinics, and any public health response related to sexual health. Let's Get Checked is a commercial lab out of Monrovia, California. They're a partner in this wonderful program called Check Yourself. So Check Yourself is the program that is managed by NCSD and involves Let's Get Checked as a partner. So I just wanted to clarify that information to begin so that I don't confuse anyone with the nomenclature. Next slide, please. Okay. So I don't have to tell any of you, but COVID-19 really decimated the capacity of sexual health clinics. So we heard about clinic closures, drastic reductions in asymptomatic screening, and staff redeployment onto COVID-19 response. So we pivoted pretty rapidly. We created a COVID command center in which we kind of collected protocols, best practices, how folks could continue providing sexual health services amidst all of these challenges. We convened weekly calls. We really just looked at the field and said, listen, how can we help you? We also created a Testing Beyond the Clinic webinar series, and we really got interested in how this concept of non-clinic based self-collect testing could help increase capacity. Next slide, please. We conducted a survey of our membership in the summer of 2020 and found that almost 90% of our members reported a decrease in patient volume in terms of sexual health testing. Over 65% reported reduced clinic capacity, and 72% reported considering self-collect testing by mail. We became more interested in this. We started talking to our members and trying to understand, if NCSD were to support such an initiative, what are some of the, the features that it should have? How could it best support public health departments? What would a public health solution to non-clinic based self-collect testing look like? Next slide, please. NCSD then formed a board subcommittee of some PhD librarians, our partners in other organizations, some of our full members, as well as partners from the Association for Public Health Labs. And we really wanted to convene some experts to understand what are some non-negotiables, what are the opportunities in moving forward with direct services, and really what are some of the features of such a program that, we'd have to have in order to make this a public health solution. Next slide, please. We conducted a comparison of multiple commercial labs, and we did a thorough review of validation and verification processes. We hired a retired PhD lab director, or excuse me, public health lab director, an APHL consultant to help us go through all this information and ensure that it said what they claimed it said. They also conducted site visits at the lab in person to make sure that the protocols were being followed. There was also conduction of extreme temperature studies, and our consultants were able to review all of that information and verify all of that. We also received standard operating procedures for state and federal reporting requirements for reportable results. And as we will explain in subsequent slides, we do have ELR, or electronic lab reporting, which means that all test results for our program, positive and negative, are reported directly to state and local health department surveillance systems. This was actually a non-negotiable from our Board of Directors Subcommittee on Home Testing. Next slide, please. We moved forward with Let's Get Checked. It is a wonderful company founded in Dublin, Ireland in 2014. They moved then to the US and purchased their own laboratory in Monrovia, California, just outside of Los Angeles in 2020. What's really great about Let's Get Checked is they're a technology company that purchased a lab. And so really having full ownership of the platform as well as the lab under the same company is really important. It's important for accountability. So if there's an issue, it's not like, oh, that's the lab's problem, or oh, that's the platform's problem. It's really full ownership and accountability, and it really allows us the flexibility to shape the program and tailor it to various public health settings, which has been a real true asset as we build this program out. Next slide, please. As I mentioned previously, our program offers ELR, or electronic lab reporting. This is the standard. It's something that happens automatic, so there's no opting in or opting out of it. So every test that is conducted gets automatically reported. The result, gets reported automatically to state and local health departments. Let's Get Checked had a lot of experience doing COVID-19 testing in schools as well as lead testing, and was able to create this programmatic infrastructure ahead of the creation of Check Yourself. I'm now going to hand it over to my colleague, Jessica Samora.
Thank you, Jenny. So for the Standard 5 kit, it detects 5 of the commonly found STIs. So for the whole blood testing, it screens for HIV-1, 2, P24 antigen, as well as syphilis EIA. For urine collection, it screens for trichomonas, chlamydia, and gonorrhea. I do want to add that we are in the process of validating both rectal and vaginal swabs for the detection of chlamydia and gonorrhea, and we anticipate that that will be available by the fourth quarter. So the turnaround time for results are within 2 to 5 days, and there's a dedicated support number that patients can call where they can receive assistance on how to collect their sample. Next slide, please. So within the test kits are all of the supplies that a patient would need to successfully administer the point of care tests, just like the dedicated support number that they can call for assistance on how to collect their sample. There are instructions within the test kit that they can use as a guide. And there's also sample collection video that they can reference for their view. I do want to point out that there is a prepaid UPS return label within the test kit where patients can either schedule in advance the pickup of the test kit, or they can go to their nearest UPS and drop it off. So really providing that flexibility and convenience to patients is really what we pride on with the Check Yourself program. Next slide, please. So there are 2 existing workflows within the Check Yourself program. The first is the in-person, or also known as the bulk workflow. And basically what this means is that entities have the test kits at hand and they can distribute as they'd like. And so this is a really great service solution for entities that have plans to participate in community testing events, DIS field visits, community health initiatives, and is also great for any universities or college health programs. Next slide, please. So for the telehealth consult, it's a little bit different than the in-person workflow, in that for the teleconsult is when an entity orders a test kit and has it overnight shipped over to the patient's home directly. And so this is really a great service solution when clinical capacities are limited, unavailable, or patients prefer not to test in a clinical location, or maybe they don't have the transportation means to do so. Next slide, please. So for entities, they have, regardless of the workflow that they choose to work with, they have access to the ordering portal in which they can activate a test kit. So that just basically means that they assign a test kit to a patient, in that the patient can now do the sample collection and then they can ship it off to the Let's Get Checked lab for testing. Once the results are available, the entity has access to those results in real time when they come in through the results portal. When a entity activates a test kit for a patient and they haven't done the sample collection yet, the patient will receive reminder emails to do so. To the patient, there is Let's Get Checked providers available to them. There's a nursing line that provides follow-up for any positive STI results, and they provide support to patients regarding any questions related to sample collection or results in both English and Spanish, and any documentation in relation to the encounters between the clinical staff and the patient are documented into the patient's portal. And patients do have access to their individual online portal where they can see their own results, also in real time. Thank you. And the next slide is just my information. So if you have any further questions, or you would like to do an introduction call to learn more, to include the service into your program activities, this is my contact information. Thank you.
Thank you, Jessica and Jennifer. I am now going to turn it over to Dr. Raj. Again, if you have any questions, please send those to the chat and we will answer them at the conclusion or following the presentations. And so, Dr. Raj, I'm going to turn it over to you now.
Thanks, Stacia. Good afternoon, everyone. My name is Shavita Rajgopalan. Also called Dr. Raj. So I'll be presenting on our LA County pilot experience using the Let's Get Checked, Check Yourself test kits. As Dacia mentioned earlier, I'm a senior physician in internal medicine, infectious disease, and associate medical director of the Division of HIV and STI programs. Next slide, please. So just a little outline of the presentation, go over the timeline, the interest in on-clinic-based self-collect STI testing, challenges that could be overcome with Check Yourself, and our onboarding experience, the workflows, and anecdotes, observation, and key takeaways, as well as our future plans. And to the right upper corner, you can see a picture of us visiting the Monrovia laboratory with a tour that they gave us of the wonderful lab. And then just to give you an idea that Monrovia really isn't the San Gabriel Valley area, it's pretty far away, but there's a lot of, LA County is huge. And so it's really like it captures all of these various parts of the county that we service in LA County. Next slide, please. So the timeline is that in September of 2021, NCSD requested assistance with pilot sites for Let's Get Checked actually is doing a validation of their rectal swab usability, and they had reached out, and that's how we came to know about the this particular project. And then we met with Let's Get Checked laboratories regarding plans for the rectal swab study, with development of a great partnership and collaboration with our ongoing I-Know home test kit rectal and throat swab validation is also ongoing. And in November, the LA County was added as Let's Get Checked, Check Yourself pilot site. And around November, December, several trainings and onboarding processes were put in place. And then in January, February, we decided that we were going to go through both the bulk shipment and telehealth workflows. But we started with the bulk shipment only because we had onboarded a lot of our DIS, who are also called public health investigators in our office, and it was more controlled that way since we had, they were trained and they could be followed up. They could follow up on all of the requests, and they also have very, very complex cases. And these bulk shipment kits arrived to us starting in around January, February when we had the surge. And so we had to wait until March to launch our actual outreaches. So we started out with 3 outreaches to the month of March because the first set of test kits were going to expire on April 1st. And it was good because that gave us a lot of opportunity to, just to push ourselves to see how the kits work in a specific type of population. And in March, April, we developed flyers as well for our sexual health clinics and our public health investigators who are out in the field in the districts, and for patient distribution and for referral, especially if clinics were closed during COVID and they were not able to get an appointment, or they just wanted to get tested in their home. So this would be a nice opportunity for them to avail of. So in May on through October, we increased our outreach efforts to at-risk venues, which we'll talk about in a bit. Next slide, please. So there's definitely interest in non-clinic-based self-collect STI testing. So it empowers patients to feel more confident, to do-it-yourself approach, increase public awareness of the importance of routine STI testing, with the knowledge that STIs are also steeply on the rise, provides more options for STI testing in the comfort of their own homes. There's amazing videos out there that can also show them the process of how the tests are done. And also home test kits available 24/7 and not tied to any clinic hours or waiting in the lobby, and concerns about exposures and things, and much more mobile and flexible. And they can also conduct their own testing, or also testing can be done in the field when if needed. And can still have access to a consult a provider if needed. And clinic closures, unfortunately, and limited sessions due to pandemic and staff deployment actually opened this opportunity for us to avail of, and also would avoid long waiting times. And there are the images of the same test kits that Jessica shared that we just put there for us to to sort of show the various components of the kit when we're talking to people, or when even in telehealth we do a video demo of what to expect and things, so they're aware. Next slide, please. So some challenges that could be overcome with the Check Yourself is definitely beneficial for patients who are not able to make it to clinic for a variety of reasons, including COVID exposure, work, school schedules. They can perform a test in the comfort of their home. And one thing to add to the mix, which I don't have on the slide, is that currently we are going through a monkeypox outbreak, and folks are at home and isolated, and some of them are requesting STI testing. And so this would be an ideal opportunity as well for them to test in the comfort of their homes while they're isolated. That minimizes barriers for testing and also lessens, the burden on clinics due to staff shortage. And telehealth option can also expedite services definitely. So this helps also increase public awareness of STI testing and gets as many persons tested as possible, so they have a variety of options, and also overcomes embarrassment for some folks who don't want to come to a sexual health clinic. Enhances case management. Public health investigators or DIS can provide also treponema tests and HIV tests in the field to confirm a diagnosis for index for individuals and to their contacts, with no need for them going into clinic. So that's really a great sort of opportunity that our PHIs used, availed of, and as well as educated others about. Next slide, please. So our onboarding experience was overall excellent. It was seamless. Our onboarding guide and specific detailed information was provided to us with all the types of tests that were offered. It was super helpful. Both NCSD and LGC staff were super supportive. They had multiple, conference calls with us. They were very patient. We've called them on numerous occasions, and yet they've been always there to support us. And also they provide us a recording of the initial training, which our trainees could refer to, and PHIs. And patient video that's online is on Vimeo is very, very helpful to share both the staff and patients on the process, and also having the actual experience and the outreach using these kits firsthand can also help us explain to clients if they want to do the telehealth workflow, how to navigate through the test kit and so forth, and helps them understand the process. Next slide, please. So we piloted both the bulk shipment and telehealth workflows. In the bulk shipment workflow, the test kits were mailed to our office, to our headquarters, and it was primarily used for people who needed a treponema test to confirm a syphilis diagnosis if they just had an RPR, or they needed a HIV 4th generation test to confirm an HIV diagnosis. Also used for contacts who are exposed to syphilis, for example, outside of the incubation period of HIV. And then also we use it for 3 great outreaches in March, and then 2 additional ones that came up in around early May, late May and early June. And the initial assessment of patients' abilities to self-collect without the PHI assistance was done by just providing a general overview of the testing process and then observing them do the tests in those outreaches and assist wherever needed. That was really good. And also in this particular workflow, our PHIs and outreaches, they usually they package the whole thing and mail it back to Let's Get Checked labs through UPS. And so that's why the return rate in the original outreach, 3 outreaches we did, was 100%, mainly because it was directly mailed by us to the lab. But furthermore, when we moved forward to the additional 2 more outreaches that we went to 2 high-risk venues in around late May and early June, in those there were so many clients coming through. So what we did was we activated the kit, we showed them what was in there, and then we gave the kit to the patient to collect it themselves and mail it back. But we noticed that their return rate wasn't really as great. I think when people want to do test and they have a symptom or they have some reason to want to know their results, that's when you have an increase in your return rate. That's one thing we realized. Now with the telehealth workflow, we had one clinic in North Hollywood where we wanted to try it in a clinic format. So it's in the clinic. One of the clinic NPs was actually teleworking, and we assigned her to 1 month of doing this telehealth workflow. And she contacted patients who are unable to wait for an appointment at the North Hollywood clinic or just wanted screening, and then she would activate and have the kits dispatched through the lab to them to their homes. And then she would follow up with them with a call to see if they received the kits, and then they would talk to her, and then they would do their testing. So STD clinic registration, our sexual health clinic registration staff and district public health nurse investigators also were informed to call our office, because that's where all of the kits were kept, and also the staff are trained to assist with activating the kits, to call us so that we're the ones who help to dispatch the kits out to them. Except for this one NP who was trained to do it herself. For the current telehealth workflow, it's just us that does it. And the PHI trainees in our office are assigned to call patients and activate and dispatch kits to them and follow up once received for assistance if needed. And also with the patients who are, we're currently opening it up to our isolated patients who have monkeypox, who may need to have, who request STI testing. The public health nurses in our districts are the ones who follow up with the positive or confirmed patients who are in isolation. So what they're doing is they're going to be offering them this opportunity to get home tests if they want. And once they do that, they'll reach back out to our office, and we will be the ones to dispatch, to call the clients, have the kits dispatched and follow up as needed. Next slide, please. So these are some pictures of our outreaches. These are our public health investigator trainees to the left when they started the first outreach. And you can see that they have several people coming in, and we had this setup where it was actually in a park where people were going to have a shower. This is mostly for people experiencing homelessness that were using the showers of hope. You could see that little van at the back in the middle slide. So then after they feel really good, they would come out and see us, and then they would want to get tested. So we got really good yield there. They wanted to get tested. But we noticed that most of them needed some assistance because they had callous digits or whatnots, and they may have needed some more assistance from our team. So that's what we noticed with that particular type of population. Now, at the lower left-hand corner, there was an event which was a high-risk venue where you can see our supervising public investigator was there with me, Joe, and you can see a client that's there, and we're activating a kit for her so that she can take it home and send it in. But unfortunately, with that kind of approach, we found a very small number of people returning the kits. And then in the middle, you could see another event we went to where it was late at night, and these were commercial sex workers in a venue that we offered the kits, and you can see the kits in the middle there. There too, we activated the kids, educated them, and we had them mail it back, but only 2 out of 30 have mailed those in. But we followed up with phone calls. Sally from our office has reached out to them, as well as some have left voicemails, some have said they haven't had a chance to get it in back. We've explained to them that the kits do expire in October, so that gives them a little push to get the test kits back. So we'll have more on that follow up. And on the lower right hand corner, I just want to see how we show you how we kind of personalized the Let's Get Checked kit by adding a little strip that says public health, check NCSD, and check yourself, so they know it's coming from LA County. And so that it kind of gives them the feeling that we're endorsing, we're helping them with the process. Next slide, please. So just to show you some results. So on the left-hand side, you can see totally up to now, the participant kit return in the field was 56. This is the bulk shipment, was 56% return rate. This was after we had the 2 higher risk venues. Even when we gave out the kits, but we didn't have actually directly mail them back, that the rate went down. We had to 56%. On the other hand, the telemedicine workflow, we had 70% return rate, but there were only 10 kits there that were activated, and seven of them returned the kits. And then the results as far as the participants, you can see the bulk shipment field workflow, we had 91 participants who had activated the kits, of which 51 had returned the kits. And of the results, in terms of normal versus abnormal, we got about 18 of them normal, and 11 abnormal, which is quite good because it was a 21% abnormality rate, but we did follow up on those, and we ensured that they got treated appropriately. With the telehealth workflow, there were 10 participants, 7 resulted, 6 were normal, there were no abnormals in that group. With that, move on to the next slide. So in terms of demographics, mean age was about 36. The range was 18 to 74 years. Gender identity, most of them were cis women who have sex, 48 was cis women who have sex with men, and 54 was cis men who have sex with women. We didn't have any who were MSM or women who have sex with women or trans persons in our group. And sexual orientation, all were heterosexual in this group. And race, ethnicity, at least that's what they identified with. And with race, ethnicity, majority were Latinx, but we had a few, followed by Black African American, a few white, and the rest were mixed. Most common type of sex reported was oral and vaginal together, followed by vaginal alone, and then there was a combination of anal, oral, and vaginal, and then there was other, which really didn't give us very details on what type that was. So, and the next slide. And this is the flyer we created for our clinics, for our sexual health clinic patients. So just showing them clearly what types of tests are being done. There's that little YouTube video, I mean, not YouTube, the Vimeo video we put with that QR code so that they can watch the video to how it's done. And then we just explain to them, if you don't have symptoms, you cannot get an appointment, the clinic is closed, you're not able to wait, you're not comfortable using electronic devices, and you are comfortable, using electronic devices, and like to access a secure portal, and you have a mailing address for the kit to be dispatched to, then give us your last name, first name, date of birth, and good time to call, and your phone number to dispatch the kit. And usually I would be the one who would triage these to our PHI trainees in the office, and then they would call, they would be reached out to. Next slide, please. And this is the second one. The next is a couple of flyers we created as well. That was a patient flyer. These were flyers for our business office staff that would, if patients can't get an appointment, so they give them this flyer, and our public health investigators in the field, and now our public health nurses as well, could use these flyers to contact us to inform the patients that there's this option, and then send us the name and contact information so we can reach out to them and dispatch the kits. Next slide, please. So some of the observations, key takeaways from our experience so far is that these routine tests, home test kits, along with education and rapid treatment referrals, can lead to decrease in STI transmission. And clients have the freedom to choose when and where to test instead of following strict clinic hours and capacity limitations. It's a very smart and efficient way to allocate resources. Telehealth option can be done without any clinical staff or PHI is being dispatched to the field. And it would be ideal for PHI field staff to carry kits with them on field visits in the bulk flow so that they can use them, when needed and offered to qualified patients and their contacts on the spot, especially when clinic appointment is not available. And they may encounter patients who once only, and they may need to act right away. And clients who refuse or are not able to attend clinic, that would be a great thing. And return rate, regardless of type of workflow, whether it's bulk versus telehealth, is very dependent. It's what we've learned is highly dependent on the client's motivation. They really want their results, they'll go for it. If not, it'll just sit on the table and nothing will happen. Next slide. So next steps are we're going to follow up on the clinic and district public health workflow, as well as this new workflow that we've developed for the public health nurses who are dealing with folks in isolation that we've just put in place. And we're also trying to do more public facing campaigning and marketing about this resource, and also plan for more outreaches at high risk venues as we go forward. And we're discussing collaborations with Let's Get Checked and the I Know Design. We're still working on this. And as new priorities of new diseases come our way, we have to try to balance that and then come up with some kind of a new brand of low cost home test kit option, and try to leverage grants and to cover costs for these. And the plan is to hopefully long-term to plan to integrate this into an STI or sexual health clinic work and field regular workflow. And we're having continued discussions with our California Department of Public Health policy team regarding Senate Bill 306, which went into effect January 2022, which states that health plans should cover home test kits in terms of cost. Next slide. I think this is the end. So it's just to acknowledge all our wonderful DHSP, office, Division of HIV STD programs, public health investigator and direct services staff, and our leadership who's promoted and supported us, and our clinic services, community field services. That's how the district staff are divided, that have also been very positive about this experience. And shout out to all our great team members, mostly all our public health investigator staff, as well as our NCSD colleagues and to our colleagues from NCSD. And just to put some few pictures towards the end of our groups, our teams, and our website, and our surveillance dashboard if you're interested to see the numbers of STIs and LA County. With that, I think we're going to end, and I have my email if anyone wants to reach out and ask any specific questions. Stop there. Thanks very much for your attention.
Thank you, Dr. Raj. I'm now going to turn it over to Lynn County with Alicia Steins.
Thank you so much. Can you hear me okay?
Yes.
Yes, perfect. So my name is Alicia Steins. I'm one of the public health nurses here at Lynn County Public Health. My presentation is you did what at home STI home testing. Next slide, please. We do not have any disclosures. Go ahead with the next slide. So how everything began, obviously everybody is fully aware of the COVID-19 pandemic and how that really had to shift our local health department, STD program staff to assist with COVID response, which led to those delays in services. Our clinic actually closed here at Lynn County Public Health during that pandemic, and which led to us determining new and innovative ways to provide those STI services. We were also aware of the CDC reports, in regards to STIs reaching an all-time high, especially within those cases of syphilis and congenital syphilis, which, is one of the reasons we had reached out to our state partners to offer STI testing services at home. Go ahead with the next slide. So we partnered with, like I said, our state partners, Iowa Department of Public Health, who had reached out to this pilot program with Let's Get Checked for the STI testing at home. We had multiple meetings to discuss the platform. Permissions and profiles were granted through Let's Get Checked, through their bulk ordering system and through the telehealth ordering system as well. Those early conversations happened in November and December of 2021. Originally, we decided to enable the telehealth portion of our electronic medical record system for clients seeking STI services at our clinic. Our clinic had reopened by then, so individuals calling our clinic, we would offer them a telehealth visit with a provider who then would send a test kit to that individual's home. To be honest with you, no one was interested in that. We have an instant gratification need. And so we revamped our workflow for and created an online survey for individuals wanting STI testing services sent to their home for their test kit. To complete this online survey that a nurse reviews and sends then that test kit to that individual. We really launched the system then in April of this year, for STI Awareness Month, where we started offering testing services through the bulk ordering system and through the telehealth piece. The bulk ordering system was, outreach to our local colleges, alternative bars, walk-in appointments at our clinic as well. Next slide, please. This is what the test kit looks like. We've already discussed that with Jennifer and Jessica. It's a discrete package delivered to the home. Standard 5 testing, gonorrhea, chlamydia, urine, and trichomonas urine only, in hopes within the near future to add on extragenital site testing as well, and then syphilis and HIV testing. Results are available to clients through an online portal system in 2 to 5 days after the sample is received at the lab. The test box does come with a prepaid UPS mailing bag as well. Next slide. So this is one of our workflows for clients that would either call into the clinic or see our online survey that we had advertised quite a bit about for clients wanting at-home test kits. They would complete the survey. So there are a few hard stops in there. Individuals will need to be asymptomatic, 18 years of age or older, not a contact to an STI, because really ideally they should be evaluated by a provider to see if it's something else going on as well. After that, if those hard stops are met, then, we do get onto the Let's Get Checked order portal, go through some risk questions, risk factor questions, some sexual health history, and order that test kit to be mailed to the client's home. The client is able then to collect their sample after they receive that discrete package, mail that test kit back in through UPS, through their processing center. They receive those labs simultaneously. We also receive those labs through the Let's Get Checked results portal. Any client that would test positive, nurses reach out to that client and offer them appointments here for treatment. If they have health insurance, we have standing orders where we could call in treatment through a pharmacy of their choice as well. If clients are in need of further testing for confirmatory testing, we have our DIS can meet that, disease investigation specialist can meet them for the blood work, or offer them to come into the clinic for blood work follow-up appointments as well. If a patient does not submit a sample after receiving it within 7 to 10 days, our nurses do reach out to that client to remind them to submit their sample. At least three calls, emails, or text messages are sent, which we usually typically reached out quite a bit more than just 3 times. Next slide, please. Our distribution workflow is pretty similar. This is when the individual has a test kit at hand, where we are handing them a test kit through an outreach event. We had created a QR code sticker where we put those onto the test kit. An individual would scan that QR code, which would take them to a survey 123 HIPAA compliant survey, where they would fill out those risk factor questions. The nurses receive that survey and then are able to go into Let's Get Checked to activate the test kit themselves ourselves. Same kind of workflow. Individual takes that kit home, collects their sample, mails it back in. Results are given simultaneously to the client through their online results portal and through our nurses through our Let's Get Checked online portal as well. Same type of step, positive results, we do reach out to get them additional testing and treatment. Next slide, please. So this would be the QR code that we created. We collaborated with our Lynn County GIS to create this online survey. We advertised quite a bit on social media for that survey. Next slide, please. So how did we get this word out on this program? Like I said, we advertised on our website. This is a few snippets of the advertisements we used. Individuals would click on that complete brief survey link. It would take them to the survey, which is the same survey as the QR code we created through Survey 123. Next slide, please. We also had some funding through another grant to do advertisement in partnership with Commando, which is an LGBTQ+ advertising specialist, and they created some advertisement for us through the Facebook, Instagram, Snapchat, Grindr, Scruff, Adam for Adam, Growler, and Jacked. Those are some samples of the advertisements that were used for the month of April. Next slide, please. So this is our data from April, just the month of April when we did our huge launch. We did have 68 test kits that were activated. 15 of those test kits were through the bulk order system. The remainder were through the surveys that were submitted. We did have a return rate of 25%, which was pretty good. We also had one PrEP referral and 26 individuals identified as MSM. You can see, for gender, it really was pretty equal for males, females, small percentage of transgender individuals identified as transgendered. We had a good age range of individuals where more were 18 to 25 was the highest that we received. And it did touch on multiple race individuals that identified with multiple races as well. Next slide, please. So this is the statistics that we received from Commando in regards to our marketing. I'm a nurse, I am not a statistic guru, but what they tell me is very good as far as our click-through rates. Next slide, please. And here's another snippet of the click-through rates through them as well. Next slide. So barriers that we received, initially, we did not do any marketing and we only offered testing for individuals calling Lynn County Public Health. We offered the initial telehealth visit. Individuals did not want that. They were not interested in the telehealth visit for our county. They wanted same day appointment. They did not like the long wait time to get an appointment, followed up by a wait time to get a test kit mailed to their home. So STI testing is not for individuals, is not for everyone, basically. Like I said, there were some limitations, 18 years of age or older, urine testing only, asymptomatic tests only. Really, those contacts would need an appointment for treatment. And also individuals with a history of syphilis. When we received those surveys, we did reach out to individuals that would mark yes to a history of syphilis to discuss with them. Really, they should have a treponemal test completed as well. So we did reach out and offer those individuals an appointment here. We did receive some incomplete surveys as well, where we reached out to those individuals and did not hear back from them. Therefore, a test kit was not distributed, just because we may have had like it was an apartment building, but we had an incorrect apartment or no apartment listed, no address listed, things like that for those incomplete surveys. Next slide, please. Some successes that we had, really learning our community and what our needs were, nurse appointments rather than a telehealth visit with a provider is what our community wanted or needed. Really, marketing is key as well. We immediately began seeing an increase in submitted surveys when we were advertising, when we are advertisement ended at the end of April, there was a drop off of individuals, seeking out at-home testing services. And really with that advertisement, normalizing those STI testing for everybody that is sexually active. We did start distribution of at-home test kit during that month of April for Get Yourself Tested with local colleges and our alternative bars. We offered incentives and sweet swag as well, which was really beneficial. And our colleges want to continue being able to offer those at-home test kits for clients when school's back in session here this August. So we're looking forward to that as well. We also began offering at-home test kits through contacts for our DIS work as well. Like I said, getting that prep referral. Sustainability, we did initiate a small billing piece as well. So really, has not been analyzed. I don't have any statistics in regards to that, but working on a billing piece for sustainability for this program is something that we're still continuing to work on and adapt as the program builds, in hopes to expand to pharmacy partnerships as well. Next slide, please. So huge shout out and thanks to our partners with IDPH, Let's Get Checked, Jeremy Martin, our college partnerships. This picture is one of our outreaches at one of our alternative bars through our outreach coordinators, Ryan White staff as well. Next slide. And then next slide. Oh, there's our contact information. If you would have any other questions or concerns or would like to discuss further, I would appreciate it. Thank you.
Thank you, Alicia, and thank you so much to Jessica and Jennifer at NCSD, as well as Dr. Raj. This has been great, learning about these initiatives and the way that they've been adopted in both LA County and Lynn County. And so now we will have a Q&A session. We have about 10 minutes to answer some questions that haven't been answered already. And so we'll try our best to get through them, but if we're not able to answer all questions, please do reach out to the presenters for more information. All right, so for NCSD, during that portion of the webinar, an attendee asked, are throat swabs an option?
Hi, this is Jenny. I can handle that. So FDA has some concerns around soft tissue damage for pharyngeal testing, that individuals may not know how far back to push, how hard to push, etc. So at this time, we are not pursuing a validation process for LDT for pharyngeal testing.
Thank you, Jennifer. Another question was, are the only tests that are not validated yet throat and rectal?
So we're working on a validation process for vaginal swab as well as rectal swab for GCCT. So those are the tests that are in process. We're also working on using the same whole blood microtainer blood for the current EIA test. We're working on reflexing positive or reactive EIAs to RPRs using that same blood. So that's something that we're working on as well. Hopefully have available by quarter 4.
Thank you again, Jennifer. And then during Dr. Raj's part of the webinar, a question was asked. So is the lab doing the tests in a van?
Is that for me? What was that question again? I'm sorry. I missed it.
Yeah, for you, Dr. Raj. It says, is the lab doing the test in a van?
In a van. So far we haven't been using, you mean the lab that's at Monrovia? No, that's a full building. So we just sample we get the tests and it's mailed back to the lab, to the Monrovia lab at Let's Get Checked. And they have a full big building with the whole laboratory where they process it. It's not done in a van. That was just a mobile unit we were standing next to in the picture.
Got it. Okay. Folks may otherwise. Another question is, what happens after the positive result is found? Is there a patient referral in place to get them treated? Does that responsibility fall on the patient to seek treatment? And this was also for you, Dr. Raj, during your presentation.
Yeah, so because the way the Let's Get Check tests are set up is there's a nurse that would reach out to the patient, tell them their results, and offer opportunities to where to go to get follow up. But we've also informed them that because we are local jurisdiction, we would like them to know that that somebody from public health is going to call them as well, because the messaging may be just unique to a variety of ways that we message for prevention, and also we would offer them treatment opportunities if they're not available, if since it's not available through Let's Get Checked per se, there's no provider that workflow there. So what we would do is we would let them know that if they want us to send a script to a preferred pharmacy, we would do that. The first 3 groups in outreach that we had that were experiencing homelessness, we actually delivered medicines to them from our own supplies.
Thank you, Dr. Raj. Another question during your segment, it says, did launching the take-home test create the need for more staffing?
Absolutely, 100%. We're all doubling up on a variety of different duties, and especially in the clinic side, we did not have bandwidth to have staff trained from our districts to actually have the kits on hand so that they can actually do the activation, because of that same reason, because it takes a minute for them to call patients and to get the information online and get them activated. And we were talking to NCSD as well as, and also Let's Get Checked about trying to use our pilot experience to help to decrease that amount of that front end intaking. And if it's it makes it really simple, it'll probably fly through much faster, and then the staff will not feel the impact as much. But the idea is to have, just do a quick activation, and the rest of it, the clients should be able to complete themselves. Yeah.
Thank you. And then another question is, can insurance be billed, and what codes are used for billing?
That's the part that the CDPH is still working on for the California state. So that there's a whole group that's been working on insurance billing, and Medi-Cal and LA Care, they're really interested in this as well. So it's on the agenda. The codes are the part that we're still working on.
Thank you, Dr. Raj. And then during Alicia's part of the webinar, someone asked, why complete a treponemal test for those with syphilis history?
Oh, thank you for your question. So what we really, for individuals that would report that they had a history of syphilis, really what we're looking for is a titer level for that individual. So there, some labs will do reverse algorithm testing, some will do standard algorithms for testing for syphilis. So having that sensitive conversation with the individual in regards to wanting to see that titer level not increase by 4 folds would be more ideal than the rapid testing screen that is completed through the Let's Get Checked program. So we do have that conversation with those individuals, and not to say we don't send them a test kit, we do, but really also offering them another appointment here for that blood work.
Thank you, Alicia. Another follow-up question during your segment was, can you share any information about the duration and cost of the marketing campaign with Commando? Apologies if that was already shared.
Oh, no, thank you once again for that question. No, I don't think I touched it on that piece. We did have some additional funding through a different grant that we had received through an integrated testing services grant. I believe, and I could probably get you exact numbers if whoever asked the question would email me directly. I could probably get you, like I said, those exact numbers and contact for Commando, but I do believe it was 20,000, I believe, and it was for the month of April.
Thank you. And a question after that was, what is an alternative bar?
Oh, so we have bars that are LGBTQ plus friendly here in our county. So it was just a kinder word to use to say an LGBTQ friendly bar.
That's awesome. And then for the group, just a few more questions. We will be wrapping up at 3 p.m. If an individual reports a concern for sexual assault, are folks encouraging a medical forensic examination?
This is Alicia. I can help answer that question. So that's a very sensitive conversation to have with an individual. If that individual would call and we're having that type of conversation on the phone, or we would receive a survey with that information on it, we would speak with them in regards to an examination by a sexual assault nurse through one of our local ERs, and explaining the reasoning behind that to that individual would be the route that we would take. We did not receive any conversation. I have not yet received a survey or received a phone call for someone wanting at-home testing services that had experienced a sexual assault.
Thank you, Alicia. Another question is, if a client or patient tests positive, do you all provide partner therapy?
We do offer EPT, and we do have standing orders for that. If anybody's interested in any of our workflows or policies, please reach out. I would be more than willing to share that, so you do not have to reinvent the wheel.
Yeah, just to add to that, yes, we absolutely, since our DIS are experts in partner services, that's the first thing they ask, you know, if do they have partners that they may need treatment, and definitely their partner therapy and EPT is provided so that they can get treated. Thanks.
All right, and one last question. Are there any grants that folks can use to fund the testing?
Well, we'd have to, use our STD Peach grant. You know, that's through our CDC that funds a lot of the STD infrastructure. We'd have to carve it out in the forthcoming years. Ending the HIV epidemic has got a different list of things. But since HIV tests are included in the STI tests, and they're really related. And there's a lot of funding in that, in ending the HIV epidemic. They could potentially be folded into the what they call the respond pillar, maybe. So it's things that we need to discuss a little further, because the STD Peach money is not a lot. I mean, it's much smaller. It's a much smaller grant compared to the one that's for ending the epidemic. So there's a couple of grants that I would suggest. I mean, we would think could fund these.
All right, thank you all. It is 3 p.m. sharp over here on the East Coast. Thank you again, Alicia, Dr. Raj, Jessica, and Jennifer for this great session. We put contact information in the chat, so feel free to reach out to our presenters for more information. Take care and have a great day. Bye-bye.